Assalamu alaikum. Welcome to Dr. Yousif lectures and today's lecture about CYP4 inhibitors and CYP4 inducers. So basically when you're talking about CYP4, see what is CYP4? CYP4 basically the one of the enzyme which is present inside the liver. So when you're talking about the CYP450 inhibitor means when we're talking about CYP4 inhibitor means those drugs which inhibit this CYP4 activity. Means when CYP450 activity is decreased, when CYP4 activity is decreased, it means the now concentration of drug is increased. It means concentration of drug increase. So when increase the concentration of drug, so it means decrease excretion, decrease excretion. So now let's talking about how can you memorize the drugs which is inhibit the CYP4 inhibit. CYP4 inhibit, CYP450 activity is decreased. If the CYP4 activity is decreased, it means the concentration of drug is increased inside the blood. If they increase the concentration of the drug, then the absolutely excretion is decreased. Now, which drug is present which is causing the CYP4 inhibitors? Basically, is one of the short form mnemonic is the stick faces, comb, and grapes. Now, stick is what? Stick basically the sodium valproate, and T means ticlonide, and I means isoniazid, and C means cimetidine, and F means ketoconazole, F means fluconazole, and A means alcohol, and C means either ciprofloxacin and chloramphenicol, or E means erythromycin, or S means sulfonamides. So these are the means stick, passes, comb. Comb means cranberry juice. Cranberry juices. And O means omeprazole, and M means metronidazole, or grape juices. Means these are the drugs which is inhibiting the CYP450 inhibitors. So these are causing the CYP4 activity decrease. If the CYP4 activity is decreased, now let's see CYP450 activity is decreased. So increase concentration of drug in blood and decrease excretion. Now let's talking about CYP450 inducer. CYP450 inducer means CYP450 activity is increased. If the CYP450 activity is increased, it means decrease concentration of drug in blood and increase excretion. Now this is one of the short form bus scrap gives. This is one of our mnemonics that is mostly useful for the CYP4 inducers. So B means barbiturate, and S means ST John Watt. Basically, this is one of the herbal medication that is mostly used for anti-inflammatory and anti-cancer drug. So bis shit or caps. Bis caps means C means and R means and A means and P means. C means carbamazepine and R means rifampicin, and A means alcohol chronic uses when alcohol chronic use when, and P means pheniotin, and G means glycophyllene, and P means and S means phenobarbital, and S means sulfonyl urea. So these are the drugs that is mostly CYP4 inducer. If the CYP4 activities inducer means CYP450 activities increase. If the CYP450 activities increase means the concentration of drug in blood is decreased because CYP4 inducer. So if the concentration, if the CYP4 inducer means the metabolism, if the activities increase, it means the metabolism is increased. If the metabolism is increased, it means the concentration of drug inside the blood is decreased. If the concentration of drug inside the blood decrease, it means the increase the excretion. So the drug is not inside the blood and the drug is going to be excreted out. So through this way, the CYP4 inhibitors and CYP450 P450 inducers, we can memorize the through the mnemonics. Okay, this is all about. Thank you, Allah Hafiz. If you any query, so you can write in the comment box.